Welcome back to another episode of Spilling the Tea with Dr. T and Gabriel
G.
and Lovely.
Welcome back to another episode. I'm super excited once again to
Here we are.
spend some time together because we never do that
Never.
and talk about something that I think helps us get a lot of stuff done.
As you can see in the title, today we're going to talk about motivation and testosterone.
Yeah, and how they're related, and how for some of us that have low testosterone, it can severely impact our motivation. And for those of us who are concerned about our motivation, maybe consider getting screened for low testosterone.
I have a bunch of questions for you today.
Oh, do you?
Yeah, be
Well,
ready.
I have lots of time and I'm very motivated to answer these for you.
So sit tight because we are going to dive into the relationship of testosterone and motivation.
So, of course, motivation is really the drive and the reason behind we do everything we do, right? So it keeps us on track with things we have scheduled. It helps us to identify things we want to accomplish in the future and really propels us forward. And so, definitely an important factor in helping you stay on track with your goals, whether they're fitness related, whether they're career related, relationship related, and really can bleed into every aspect of our lives. And there's so many things that impact our motivation, from psychological factors, biological factors, environmental factors, and all of that hopefully we'll be able to touch on in this talk. And then also, of course, bringing it back, mainly focus on those biological factors, as that's what a lot of men out there that may be struggling with their motivation can do something about and can make an impact to improve how they feel. So let's dive in. Let's get into the nitty-gritty.
Let's get down into the nitty gritty. So, I have a horrible memory. Tell me what testosterone is.
Right. So we've talked about this a few times, but if this is the first time you've watched one of our videos, or maybe you'll watch the previous ones later, or if you've been along throughout the journey, you know testosterone is the male dominant sexual hormone. It's involved with multiple different processes, things that happen in our mental health, our physical health, and that, of course, overlays our sexual health, fitness goals, and so many different things there, as well as our motivation. We do know that testosterone is one of the prime reasons that men stay motivated, especially when their values are optimal. And we do see a strong clinical correlation for when our testosterone is low, it can impact or damage our ability to stay on track and stay motivated. And so, again, testosterone is that male dominant sexual hormone that is really going to keep us moving forward, both mentally and physically.
And what is the link between motivation and testosterone?
Yeah, we're going to get into the major details of this later, but we do know that there is a strong correlation that our testosterone values will reflect how motivated we are. And of course, testosterone is important with dominant type behaviors. It's important with staying on track, staying focused, and our energy level. So all those things do come together to really sort of drive our motivation forward. There are different areas of the brain that this is going to enhance and sort of support, and we'll get into more of those specific details in a little while.
Very shortly.
Yeah, very shortly.
Stick around. We talked about this a few times, but let's refresh our memory again.
Let's go into it.
How is our testosterone produced?
So we've talked about this, as you mentioned, in previous videos, and it's a multi-step process to how our testosterone is finally being produced in the gonads or the testicles. It starts in the brain, specifically in the hypothalamus. That sends signals to the pituitary gland, which is close by in the brain. And then the pituitary gland sends signals to the testicles saying, hey, let's crank up that testosterone production, as testosterone does come from the testes. But it's a multi-stage process. So it's difficult to just say, oh, they come from your testicles, because testosterone doesn't necessarily start there. That is where the product is finished. But that's why a lot of different things that can impact our mental health can impact how our testosterone is produced, because it starts in the brain.
Testes. I love the nickname.
No, that's really their name.
No way.
That is the biological name, is your testes.
Testes. It's
Yeah,
cute.
It's cute.
Testes.
Testes. We should have a cat named Testes. Anytime we have a cute name, I say we should have a cat named, and then we don't have a cat. But one day.
We have a big list of names, so...
For the cats. It'll be like 50 cats.
So why do we need optimal testosterone?
So just going into the role of what testosterone does, of course, it's the most important factor to help us through puberty, to evolve into our secondary sexual characteristics like facial hair, muscle development, deepening of the voice. And after that, sometimes our testosterone value for some of us will start to plateau or even plummet. And having optimal testosterone allows us to sort of maintain the same benefits that we experienced during puberty, but later in life. So you'll see, of course, an enhancement in the ability to maintain and achieve increases in your muscle status. You'll be able to maintain your libido or sex drive, or maybe even see it peak. And then, of course, our mental health. Testosterone is so important with our cognitive functions, such as memory. It's important with how we use energy and bank or store energy in our muscle cells. And of course, it keeps our motivation and our drive moving us forward to accomplish more goals and to stay on track. And so, having optimal testosterone values is going to help you to maintain all of these functions. We often see men that have a difficult time with their memory, a difficult time with their libido, a difficult time maintaining or achieving increases in their muscle status, as well as with their motivation. They often have low testosterone. So, we do know that there is importance in having that level higher so that you feel your best.
And how exactly does testosterone impact our motivation?
Well, motivation is sort of difficult to pin down because it's not a specific measurement that
Right.
you can sort of track. We do look at a couple clinical studies, one which showed that increases in testosterone or optimal levels of testosterone showed men in social and work environments were often more dominant and so able to sort of steer the situation and wanted to be more in charge. We also have clinical evidence to show that if you have low testosterone, it's more likely you'll experience a decrease in your energy levels, anxiety, depression.
Wow.
And so all of those things would, of course, impact your motivation. So overall, we're looking at what the clinical evidence has shown us in regards to those that have a higher level versus those that have lower levels. And what we do know is the higher, more optimal testosterone values seem to support the factors that would result in a more motivated individual, more driven, more focused on achieving milestones or those goals.
Wow, that's crazy.
Yeah, so super interesting. And certainly, in my clinical history of treating patients, we've seen this. A lot of my patients do report to me, hey, I just feel more motivated. I'm
Right.
getting more things accomplished. I'm more organized. And that just attests to what, the research has found.
So refresh our memories again. What are exactly the physical symptoms of low testosterone?
Right. So there are multiple physical symptoms for those that have low testosterone. Oftentimes, it's going to have to deal with a difficult time losing body fat, a difficult time increasing their lean muscle mass. They may even notice changes in their body hair. Low testosterone can cause, in severe cases, body hair changes and a decrease in body hair. In regards to the increase in body fat, we do know testosterone is really important with regulating how our body uses fat as an energy source, as well as storing it for later. So for patients that have low testosterone, we often see there is an increase in their body fat, specifically in the abdominal area. It seems to be the place that testosterone highly is able to either move it or store it if it's low. We, of course, also see patients that have low testosterone typically report a reduction in their muscle mass or a difficult time increasing their muscle mass. This is because testosterone is highly involved with how our body is building new muscle as well as using muscle as an energy reserve. That's where we store a lot of our metabolic activity. And then, of course, in the most severe cases, this is pretty uncommon. Some patients will notice patchiness in their leg hair, or maybe if they have hair on their back, that starts to change. This could be a sign that their testosterone values are not supporting that hair growth, which should be occurring, and testosterone is associated with that. Again, not the most common symptom that you would see in a physical change, but if you've noticed all of these things and you're also seeing hair changes on your body, it's likely that you've had low testosterone for some
Wow.
time, and it's critically low.
Other than physical, what are the psychological symptoms of low testosterone?
Right. So the psychological symptoms of low testosterone are going to include things like fatigue or lack of energy. Sometimes patients will report having mood disturbances or feeling more irritable. Sometimes they'll report a lack of motivation or a
Wow.
difficult time staying driven or on task. Of course, in regards to fatigue and lack of energy, we know testosterone is one of the most important regulators of the energy we have available. It's also important in regulating how we're able to store energy. That also is tied into some physical changes as testosterone uses our muscle to basically store energy for later. And so we know that that's a key culprit for why patients with low testosterone often feel fatigued because they're going to have less energy in their bank or reserve. Then we know, of course, testosterone impacts our mood as clinical evidence has shown those with low testosterone often feel depressed, anxious. There's an increase in their irritability, and this is commonly reported. And so by notating that, we do know there's a strong correlation there. And then in regards to motivation, of course, we are making this sort of discussion about this topic because we do know that testosterone is highly involved in keeping us on track. And so for those of us out there that have low testosterone, that's one of the key symptoms that we'll see is feeling like we have a lack of drive or motivation.
That's why patients say they feel more motivated in their workouts or even throughout the day, even doing routine stuff, doing
Right.
normal stuff. They feel more motivated. They feel that they have more energy.
Yep. And that's why oftentimes too patients will say to me, I feel like this is how I've always supposed to felt.
Right.
This is I've been wondering what's wrong and now I feel like myself again. And so it's definitely reassuring to hear when people are on an effective treatment strategy that they're feeling like themselves again.
Right. And that makes sense because now they have their testosterone levels restored back to where they were in the past.
Exactly.
So biologically speaking, what is the impact of testosterone in our motivation?
So the mechanism of how testosterone biologically is going to impact our motivation starts in the brain. We know that testosterone is going to enhance and adjust the way that neurotransmitters are released in the brain, specifically dopamine and serotonin. And they have specific action sites that are in charge of where our motivation is sort of honed in the brain. And we do see through clinical study that these areas are more heightened when testosterone is at an optimal level. We know that the two areas of the brain that testosterone is impacting in these clinical studies and releasing more dopamine happens to be the prefrontal cortex and the nucleus accumbens. And I think we've actually talked about these before, as those areas are also regulating other important functions that have to do with our hormones. So we do know that optimal testosterone values are going to enhance those areas which are in charge of keeping us motivated.
Nucleus accumbens, that's another name for a cat.
Yeah, nucleus accumbens. Sounds like a cloud.
A cloud?
Yeah, I think there's like nucleus clouds.
Right.
And I don't know.
Something like that.
Something like that. This isn't a cloud talk.
So what are exactly the effects of low testosterone in our mood, in our well-being?
Right. So it's a little bit difficult to nail down a lot of these things because they are hard to measure. Clinically, there's not a lab value and you can do neuroimaging, but it becomes a little complicated. So what we do know is testosterone is tightly regulating our mood and our motivation levels based on, clinical responses from patients that have both high and low testosterone. And so we know that patients with low testosterone often have an increased risk of anxiety, depression, and when that is corrected through testosterone replacement therapy, they feel better. And that is not to include things like antidepressants or anti-anxiety medication. That being said, not all causes of depression or anxiety in men is related to low testosterone. It's just important to find out the root cause because the treatment options are going to be different. And that being said, that's kind of how we know that testosterone is regulating our mood and whether or not we're able to stay on task.
So since we're talking about medications, are there any treatments for someone who is suffering with low testosterone?
Yeah, absolutely. So for patients out there that have low testosterone and they're not sure where to go next, or if they don't know if they have low testosterone or not, first thing, of course, you want to get your labs tested to see what your values are, working with either your primary doctor or a hormone specialist or endocrinologist. And of course, if it comes back low, there are different formats for testosterone replacement therapy. Some patients will choose to start a cream or a gel or an oral pill. There's injection methods. Of course, we do know through how long we've been treating patients with low testosterone, the injection method happens to be the most effective at sustaining a optimal testosterone value in the bloodstream for long periods of time. So that's usually what's recommended. And we do see pretty quick changes in how those patients feel and how they respond to treatment. Typically, most patients will see an improvement within the first 2 to 6 weeks in things like motivation, energy level. So a really quick turnaround time when you think of how medical treatments often work and can take quite some time, especially when it's mental health related concerns. But of course, the most important thing is making sure you have an accurate diagnosis and that this is the cause for your change in motivation or energy levels, because there are many different reasons that you can feel less motivated, and you want to make sure that you're finding the most effective way to get you feeling better.
First step is to get tested.
Yeah.
And
first
see your
step.
levels.
Exactly.
How effective is TRT in restoring motivation?
Right. So testosterone replacement therapy is going to be extremely effective in restoring motivation for patients that have low testosterone. Again, this is why it's so important to talk with a doctor, get screened to make sure that that is the cause of your symptoms.
Right.
Otherwise, if you have, optimal testosterone and you're still not feeling motivated, there's something else that's going on, and TRT is not going to be the answer for you or solution for you. So again, it's really important to find out what the cause is for your changes in mood or motivation before starting TRT.
Are there any lifestyle changes or natural remedies to treat low testosterone?
Right. So the number one lifestyle change that you want to consider is exercise. Exercise and weightlifting are the most powerful stimulus that we can put on our muscles, which are a great stimulator themselves in engineering the body to make more testosterone. Certainly, this is going to take some time. It's not going to happen overnight, and you want to make sure you're sleeping well, as sleep is a huge factor to help to support the natural production of testosterone and ensure you're resting from those workout routines. So yeah, it's just going to take a little bit of time. Usually 3 to 6 months, you'll see an improvement overall in your testosterone values. And of course, exercise is always going to be the theme here as a great way to not only improve your testosterone, but to reduce the risk of other chronic diseases.
Exercise is always the theme here in those podcast videos, as
like
well as sex. And we learned that sex is cardio, so sex is exercise.
Why not?
It's all correlated.
Yes.
More
And
sex, more exercise, more testosterone, more happiness.
more motivation.
Speaking of exercise, how does diet impact our testosterone?
Right. So, of course, you want to have a balanced diet with lots of fruits and vegetables, lots of unprocessed food. Of course, we live in a society where processed food is abundant and it's hard to avoid it. So, certainly that's going to be in your diet here and there, but you want to make sure it's not the bulk of your diet. You need to have plenty of protein, as protein is essential for our body to make testosterone and to ensure its continued release, as that helps our muscle cells maintain their size and their metabolic activity. You do want to make sure too you get plenty of nutrients and vitamins in your diet. You don't necessarily need to run out and buy a bunch of supplements, but we do know that zinc is important, vitamin D is important, omega-3 fatty acids, magnesium. These are all things though that are going to be in a well-balanced diet without you having to go too far. Just make sure there's plenty of vegetables, as that's usually a great source for all of these things.
Good thing we eat a lot of vegetables and fruits.
Yeah.
Our diet is balanced.
Well, we try. It's time for the myths.
It's that time of the day. So all men with low testosterone experience poor motivation.
So while low testosterone values can be associated with a decrease in motivation or drive in some men, not all men with low testosterone are going to have this symptom or feel like they're less motivated. Of course, it can be a common one. And so if you do have that concern, certainly talk about it with your doctor. But a lack of motivation has many factors that can be at play, things like our mental health, our physical health, and beyond our hormones. And so again, not every patient that has a lack of motivation is going to have low testosterone, and not every patient with low testosterone is going to have poor motivation.
But most likely.
But it's possible.
Yeah.
It's definitely something to consider and definitely reason to get tested
Right.
and make sure that's not the cause for you.
I'm just thinking someone who has very high testosterone, they, at least in my head, they're very motivated.
They're definitely going to be getting things done.
at least it seems like.
Yeah, and
technically.
it also depends. There's patients that start TRT to optimize their testosterone, or patients that have high testosterone that I've seen that their lifestyle doesn't really support them to stay motivated as
Right.
well. So you really have to make sure that you are putting the effort behind it as well. One of the great things about people who start TRT is usually it is something that helps to keep them on track. It's a part of their schedule and routine, and they know that having optimal testosterone values, it's important to use that to catapult them to that next level. And so it almost like they go hand in hand, right?
Right.
When you start TRT, you feel more motivated to make sure you get the most out of your progress as well. So it's very interesting to see.
What about the opposite? Motivation's issues are solely related to low testosterone.
Right. So testosterone is not the only factor impacting our motivation, which we kind of talked about a little bit already. But there's no indication that just because you are not motivated, that you then have low testosterone. You certainly need to be screened appropriately before determining that as the cause. And there are many other causes that you want to consider. So certainly talk to a doctor who can get you screened and talk about what lifestyle factors or mental health concerns may be impacting your motivation. Again, there's no direct link between the two. There's just a correlation.
This is a good one. And often asked, all men with low testosterone require testosterone replacement therapy.
So this is not true. Not every patient out there that has low testosterone is going to qualify or be suitable for testosterone replacement therapy. That's why it's really important to talk to a doctor to make sure it's an appropriate option for you. Some men may choose to try lifestyle changes or dietary modifications to see if that improves how they feel. But a majority of patients that are appropriate for testosterone replacement therapy are going to see a substantial improvement in their concerns, including motivation, energy levels, beyond the many other symptoms that are associated with low testosterone.
So who wouldn't be qualified or suitable for TRT?
So that's a great question, and it's really going to depend on your medical history, what medications you're currently taking, and what symptoms you currently have, as well as the interpretation of what your primary doctor or endocrinologist is going to think is best for you. I don't want to say there's an exact, hard line that you can't have TRT if you have X, Y, or Z, because it's really, again, going to be dependent on how comfortable your provider is with your medical history.
Is TRT a quick fix for motivation issues?
So while testosterone replacement therapy can provide a substantial improvement for a lot of patients that have motivation issues, not everyone's going to respond to therapy very quickly. Some patients will see improvement in as early as 2 to 6 weeks, but it can take a few months for some patients to see improvement, maybe even as long as 6 months. So every patient's going to respond a little bit differently. It's important that you are working with your doctor and keeping them updated with your progress so that they can make sure that you are on track and make adjustments to your dosage if necessary to get you feeling your best as soon as possible.
Does high testosterone always equal high motivation?
So while higher testosterone values have always correlated to a higher level of motivation or a higher level of drive, not all patients that have optimal or high testosterone values are going to be highly motivated. And that's because motivation has many different factors that can impact it, such as environmental factors, if you have anxiety, depression, or some of these other concerns that can still happen even though your testosterone is optimal. What we do know is if you have low testosterone that's resulting in a lack of motivation, having higher values is going to improve your motivation. But if there's issues that are causing your motivation changes that are beyond your hormone levels, having optimal testosterone may not be the reason that you feel better or feel more motivated.
Interesting. So it's most likely that they're linked, they're related, but not for
Right.
sure.
Exactly. So there's many different causes for a decrease in motivation. If you have low testosterone, improving your testosterone will improve your motivation. But if your motivation changes are caused by anxiety, or maybe you're not sleeping well, or stress in your environment, then having optimal testosterone values may not be enough to, further improve your motivation until those other issues are resolved as well.
Okay, so last question of the day. Natural remedies can fully recover testosterone levels and motivation.
So while we know lifestyle changes like improving exercise, sleeping better, dietary changes like making sure you're getting all the nutrients that you need, plenty of protein, can certainly enhance and support your testosterone values for some patients. The majority of patients that have clinically low testosterone or have been diagnosed with low testosterone will need more medical intervention to see a substantial improvement. It's really going to depend on you and what your doctor thinks is the most appropriate for you. So I always recommend getting yourself screened, talk to your doctor. Trying those lifestyle changes on your own first is always great, but if you don't see that substantial improvement, you may need a more appropriate medical intervention like testosterone replacement therapy or something different. I would, again, definitely recommend talking to your doctor to find out what's best for you, but typically lifestyle changes, supplements, dietary changes are only going to take you so far, especially if your testosterone values are low.
So if you're feeling low motivation, talk to your doctor and check your labs.
Yeah, it's as simple as that. Get a fresh screen on where your testosterone value is, see what's going to be most appropriate to get it back on track and get you feeling better so you can get back to your typical motivated self and start checking off those goals.
Yeah, it's a new year, a new beginning. It's not a new year anymore. I mean,
It's always a new year. It's always a new beginning. It's always a new day. Whatever you want to call it to get
Yeah.
yourself moving forward. Don't wait on that next sort of big moment or
Right.
that next resolution.
Right, the New Year's Eve.
It's a new hour. It's a
No.
new minute.
It could be right now.
Right now.
Your journey starts today.
That's what Ash Ketchum says.
There's another deep cut.
If you know Ash Ketchum, you're a friend of ours.
He definitely has high motivation, I think.
Yeah, he must have some great testosterone.
Well, he's young. He's
Yeah,
12.
He's going through puberty. All the good old days.
Good bits. Well, those are my questions. Those are the myths, and you responded again perfectly.
Oh, I do my best. But thank you all for joining us on this discussion, talking about how motivation and testosterone are tightly associated and correlated. If you have concerns or questions, don't forget to talk to your doctor or a medical professional who can give you some great guidance. If you have questions for us, leave them in the comments below. We will address those either in the comments or make another video in the future. Also, I think we're supposed to ask for them to like,
Share,
subscribe,
subscribe,
screenshot, drop a pin,
love,
leave a poem, write us a journal entry, essay, something below.
Yeah.
Tell us about yourself, and we look forward to seeing you next week.
Yeah, the topic will be, we don't know yet, but we're working on it.
We're working on it. You'll find out next week.
It's probably something related to sex
Or hormones.
or sleep,
Or health.
exercise, diet.
I was going to say food, and you said diet. I was just always thinking the same.
We're always thinking the same. We're actually the same person. We're actually, one of us is AI.
Yeah.
Yeah.
Huh.
Mm.
I always thought of that about you. Anyways, see you next time.
See you next time. Maybe Lovely is going to sing it to us.
I'm gonna break you off. Let me be your motivation.
Think about it. Okay.